My name is Darcy Trimpe. I'm the U.S. Medical Director for Amgen, and I work on the Tavneos team. Tavneos is indicated for two rare diseases. One is granulomatosis with polyangiitis, and the other is microscopic polyangiitis MPA, which fall under the umbrella disease of ANCA-associated vasculitis. They're two of the three diseases. The data that we presented at ASN and are also going to be at ACR is the first real world evidence that we're presenting. And it has some early outcomes data on patients that have received Tavneos in a real world setting. And this is the first data we've been able to release with outcomes since Advocate. So this is, as I said, it's a real world study. It's it's retrospective observational cohort study where we identified patients at Mass General Brigham Healthcare System. This study included patients that were prescribed avacopan between December 1st of 2021 and April 1st, 2024. At ASN and ACR, we're reporting on data collected from a year prior to 6 months follow-up relative to the data there of avacopan prescription. The data were extracted by manual review and as structured data. So we wanted to describe the baseline characteristics and some of the disease manifestations of the patients that have been prescribed avacopan. We looked at complete remission, which we defined as a BVAS of 0 at month 6. BVAS is the Birmingham Vasculitis Activity Score, which is used in the majority or used in all the clinical studies for vasculitis. So we looked at complete remission, which was defined as, again, as I said, as a Birmingham Vasculitis Activity Score at month 6 of 0 and no glucocorticoid use for GPA or MPA after month 5. We're reporting on the initial 80 patients that were prescribed avacopan. Of those, the mean age was 59. The BVAS median was 10. 70% were female, 65% were newly diagnosed, and 53% had MPA, and 60% were MPO positive. So MPO is one of the autoantibodies that is associated with ANCA-associated vasculitis. So of the 80 patients that were prescribed, 67 initiated avacopan, and at 6 months, 66% had achieved a complete remission. Of those that had kidney involvement, at the time that they initiated avacopan, 81% had achieved complete remission. Those with ear, nose, and or throat involvement, 70% had achieved complete remission. And those with pulmonary involvement, 66% had achieved complete remission. So we wanted to look at not only the overall population, but some of the manifestations and to be able to expand on the different manifestations as this disease is systemic and can affect really any organ in the body. So overall, in conclusion, a large proportion of the users overall and across the subgroups of organ involvement discontinued glucocorticoids by month 5 and did achieve a complete remission by month 6. In patients with the kidney involvement, we also reported a reduction in proteinuria and improvement in eGFR.